All right, I'm going to be doing my IV push practice video, and I'm going to be giving digoxin. So the first thing I would do is compare my MAR to my doctor's order. I'm looking for the right time, the right amount, the right patient, the right route, and the right medication, and the right patient. So we're going to be giving digoxin 0.2 milligrams IV push. It can be given diluted or undiluted. We're going to be giving it over 5 minutes. I'm just going to be checking these to make sure my patient doesn't have any allergies, and my patient doesn't have any allergies. And while I have this in my hand, I'm going to go ahead and pick up my medication and compare my medication to my MAR. What I'm looking for is I'm looking for anything that looks unusual in the bottle, and I'm looking at the expiration date as well, and it doesn't expire till 2020, so the medication is good. All right, and I'm finished with this. So next I want to go to my drug book. I want to read about the medication and make sure we're giving a safe dose. The recommended dose says 2.4 to 3.6 micrograms per kilogram per day, given once daily. The dose can be adjusted every 2 weeks according to clinical response. And then for dilution, like I said, it can be given undiluted, or each 1 milliliter can be diluted in 4 milliliters of sterile water, normal saline, or D5W. And we have D5W hanging today, so we're compatible with what's hanging. The rate of administration, each single dose needs to be given over a minimum of 5 minutes. So we're going to be given over 5 minutes. And then for our precautions, we want to avoid this medication in patients with heart failure. So we want to make sure to check their apical heart rate to make sure it's above 60 before we administer. And then we want to also make sure that we teach the patient and monitor the patient for signs and symptoms of DIG toxicity, which are anorexia, nausea, vomiting, vision changes, and cardiac arrhythmias. So it's very important to check those DIG levels, those lab levels, and keep a close eye on those. And also, since this is a digoxin pediatric dose, it says the earliest and most frequent manifestation of DIG toxicity in infants and children is the appearance of cardiac arrhythmias, including sinus bradycardia, and EKG monitoring is recommended in pediatric patients. So we know that our drug is a safe dose, we know what to dilute it with, we know how fast to give it, and we know what to watch for with our patient. So now we are ready to start preparing our equipment. So I'm going to set my book to the side, and before I start touching any of my equipment, I'm going to wash my hands. So I'm going to put this in my hands. And I've already worked my drug problem, and my drug problem says that we're going to be given 2 mLs of this medication. So I'm going to be drawing that up. Okay, my hands are clean. I've got my medication, and since it's already opened, I want to go ahead and scrub the top. Scrub the top for 15 to 30 seconds. Syringe. I'm going to take this needle off because I want to draw this up with a blunt tip needle. Right. The first thing I'm going to do is I'm going to pull back 2 mLs. And I'm going to inject my 2 mLs of air, no medication. I'm going to draw it up. Making sure I don't have any bubbles, air bubbles. Scoop. Okay, and I'll show you that I have 2 mLs. All right, and the next thing I would want to do is put my label on, and on my label I want to make sure to put my patient's initials. I want to put the dose, so I want to put digoxin 0.2 milligrams. the date and time that I prepared the medication, and then I want to put my initials because I'm the one who prepared it. So I would take off my label. I'm going to attach it to my syringe. Right, and once I have it labeled and I know everything about my drug, I am ready to go to my patient's room. So to my patient's room, I need to take my medication with the label. I need to take my MAR, and I need to take an alcohol pad. So I am going to my patient's room. So in my patient's room, I'm going to identify my patient. So the first thing I'm going to do is identify my patient. I want to check their armband. I want to check their armband, and then I also want to ask their name and date of birth, introduce myself, make sure they know who I am, check their name and date of birth, make sure it is verified, and check their armband. The next thing I want to do is explain the procedure. I want to ask the patient if they have any allergies, so I want to make sure, even though we read that on the chart, that they verbalize that they don't have any allergies. I want to explain the procedure. I want to explain that the doctor has ordered digoxin to be given IV push, but this is not going to involve any additional needle sticks. That I am going to be administering this medication over 5 minutes, so I'll be in here with them for 5 minutes, and I'll be monitoring them the whole time. It'll go through their IV, so make sure they understand the procedure. And then I want to wash my hands before touching the patient, so I'm going to pick up hand wash. I'm going to wash my hands. All right, and then I'm going to assess my IV. Before I start administering my medication, I want to make sure there's no redness, swelling. I want to ask my patient if they're having any pain in their IV site, any leaking fluids, anything of any concern. If there was, then I would want to make sure to fix that before administering the medication. And then I want to check for patency, so I want to lower the bag of fluids below the level of the arm and check for blood return. And there's blood return, so the IV is patent. All right, and now we are ready to start giving our medication. So while we are giving the medication, we want to monitor for those things that we read about, the signs of digitoxicity, so the anorexia, nausea, vomiting, vision changes, and cardiac arrhythmias, so we want to keep a close eye on our patient. The hub that we want to use for this IV push is the hub that is the closest to our patient, so it's going to be this hub here. So we want to clean this for 15 to 60 seconds. Okay, and being careful not to contaminate it. All right, I'm going to take my label off so I can see exactly how much I'm pushing. And I'm going to take my needle off since this is a needleless push. All right. Now I'm going to attach my medication. All right, so I'm given 2 mLs, which means I'm going to be pushing 0.4 mLs over 1 minute. Because I'm giving it over 5 minutes. 2 mLs over 5 minutes, so I'm going to be pushing 0.4 mLs per minute. So while I'm pushing, I'm going to clamp off behind to disrupt the flow, and then whenever I'm done pushing, I'm going to release so it'll flush the medication through. Okay, so I am going to start at the 45 mark just because I have to start on an even number. Okay, so I'm going to clamp. I'm going to push 1, 2, 3, 4. Okay, that's 0.4. And then I would unclamp and I would wait for 1 full minute. Okay, and I would clamp, and I would push another 0.4. 1, 2, 3, 4, and I would unclamp and wait another full minute. And I would continue to do this, and I would continue to monitor. So I would wait another full minute, and then I would clamp and push my next 0.4. 1, 2, 3, 4. Unclamp, let it flush, wait another full minute, clamp, push another 1, 2, 3, 4. Unclamp, let it flush, wait another full minute. I would clamp, and then I would push my last 4. And then I would open it up and let it flush. Okay, the whole time I'm pushing the medication, I'm monitoring my patient, making sure they're not experiencing any side effects of the medication. When I'm finished pushing my medication, I want to make sure to discard in the sharps container. And then I would want to make sure to document the procedure in the MAR. I would want to make sure to document in the MAR. I would want to make sure I would document the dose, so the 0.2 milligrams. I would document that I gave Digoxin. I would document that I gave it IV push in their IV with D5W hanging. So I would just visualize my patient. I would make sure that they were okay and that they didn't have any reaction to the medication, and then I would document that they handled the procedure well.